Hello and welcome to our video on obesity and heart attacks. We begin in Dr. Pyle's office at the hospital where a young patient named Anthony visits for his annual checkup. Anthony is first asked to complete a medical assessment form. Once he's given the form, he thinks back on his daily habits and checks off all the categories that apply to his lifestyle. After reading the responses, Dr. Pyle recognizes that Anthony's lifestyle habits are unhealthy and can lead to obesity. He begins to explain how obesity can result in more severe conditions such as a heart attack. He first talks about how the last 41 years have seen a consistent increase in obesity rates across the world. This is problematic because obesity increases the risk of other conditions such as heart disease. The heart needs oxygen to work properly, but in a heart attack, this process is interrupted. This can happen because of plaque, which is a substance made up of fat, cholesterol, and white blood cells. Buildup of plaque inside arteries of the heart can cause a blood clot, which then blocks the flow of oxygen-rich blood to the heart muscle. Without oxygen, the cells of the heart begin to die. This can then stop the heart muscles from pumping effectively. Obesity is associated with many conditions such as diabetes, hypertension, and high cholesterol. However, chronic inflammation is one of the most damaging states. Subcutaneous and visceral fat are the main types of fat tissue and are both increased in obesity. Excess visceral fat releases high levels of inflammatory chemicals into the bloodstream. These chemicals can cause damage to blood vessels and increase plaque formation, which can eventually lead to a heart attack. This effect has been very well researched in the past. According to a well-known heart study, BMI increase of just 1 point can cause a significant increase in the risk of heart failure. An electrocardiogram, or ECG, is the first test done to diagnose a heart attack. It records electrical activity of the heart through electrodes attached to the skin and can detect unusual changes in heart function. Blood tests can also be very useful in detecting heart attacks. These tests look for a protein called troponin in the blood. When the heart cells die, they release troponin into the bloodstream, and these levels are measured through a blood test. Troponins are regulatory proteins found in heart muscles which help the heart to pump blood. After explaining obesity and the associated risk of heart attacks, Dr. Pyle explains what changes Anthony should make in his lifestyle so he can remain healthy. Implementing a healthy diet and regular physical activity are important to prevent years of plaque buildup and to maintain a healthy weight. To accomplish this, a diet with moderate levels of cholesterol, fat, and sugar should be maintained. It should also include a balance between fruits, vegetables, grains, and proteins. Also make sure to get the recommended 150 minutes of physical activity per week. The consumption of alcohol or nicotine should also be avoided. The choices you make every day will have long-term consequences. It is important to realize that what you do now will impact your future heart health. As of 2019, it is estimated that over 150 million children in the world are obese, and that this number will increase to 206 million by 2025. So how will you choose to live your life after knowing the risks of developing a heart attack due to obesity? If you would like to learn more about this, you can visit these reputable sources. Thank you for watching our video. You are welcome to share what you have learned by using this hashtag on Instagram, Twitter, or TikTok.